Well, many of you have reached out to us to let us know how much you appreciate and trust WBZ's Dr. Mallika Marshall for all the information on the coronavirus. We want to say thank you and let you know that we will continue to get answers to your questions. And with that, let's bring in Dr. Mallika Marshall. Good to see you, Doctor. We start with Uno this afternoon, who writes, we have seen many articles on using UVC lighting to sanitize items, even hospital rooms. Is it a worthwhile investment for home use?
So ultraviolet light, we know, can kill germs, including viruses like the coronavirus. And they're actually studying the use of UVC light in public places like hospitals and airports and shopping malls to see if it can sort of decontaminate the air of virus. Now, UVC light is healthier, or it's less dangerous to humans than UVA and UVB light, which we know can cause skin cancer. But UVC light can irritate the eyes and can irritate the skin. So these machines are typically put up in the ceiling, sort of away from humans, or used in unoccupied areas. Now, there are those UV wands that are being marketed for home use, but really they haven't been tested for the coronavirus, and they could potentially be dangerous, so I would stay away from those.
All right, so don't run out and buy one right now. All right, thank you, Doctor. Marion in Boston asks, I saw a report that dogs are being used to sniff out COVID-19. Does it endanger the dogs?
That's a good question. There are researchers at UPenn that are looking at Labrador retrievers to see if canines can actually sniff out coronavirus in humans. If they are found to be able to do that, imagine that they could screen hundreds of people and identify those that might need to be tested for the coronavirus. Now, there have been a couple of reports of dogs who have tested positive after exposure to humans. I know some experts are sort of calling that into question as to whether those test results were real, but either way, I'm sure that the researchers at Penn are going to look more closely at that.
All right. Elise writes on Facebook, if you have symptoms and you get tested and you are negative, do you still have to quarantine for 14 days?
Yeah, so if you have symptoms of coronavirus, you need to isolate yourself for at least 10 days, but in many cases longer than 10 days, even if you've had a negative test. And that's because the coronavirus tests aren't perfect. They do miss some cases, and so you could end up with a false negative, which means you have a negative test, but you actually have the coronavirus.
All right, Di writes on Facebook, do you have to wear a mask while you're driving a car?
This is another good question, because I've seen people riding alone in their cars with masks on. If you are alone in your car, you don't have to wear a mask. If you are driving with people who you live with and you're all healthy, then you all don't need to wear masks. But if you are unhealthy or you're driving in a car with people who you don't live with, then really everybody in the car should be wearing a mask.
Yeah, I got to say, I see it a lot. People driving alone in the car with the mask on, and I can't wait to get that thing off when I get in the car.
But Doctor, it might be easier than having to take it off and put it back on.
Good point. Dr. Mallika, always nice to see you. Thank you so much. If you have a question for Dr. Mallika Marshall, there are 3 ways to reach out to her. Her email, drmallika@cbs.com. On Twitter, her handle is @Mallika Marshall. Or Facebook, you can message her, Dr. Mallika Marshall.